This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Eris, a senior attending in the department.
And I'm Dr. Alara, a research fellow. Today we're looking at a fascinating new study from the British Journal of Hospital Medicine titled Brachial Plexus Birth Injury, Current Concepts in its Assessment and Management, published in 2026.
This is a topic that sits at a very sensitive intersection of obstetrics and neurosurgery. Even though it is considered an uncommon obstetric complication, the impact on the patient and the family is immense. Alara, for our residents listening, how does the paper characterize the clinical trajectory of these injuries?
The paper emphasizes that brachial plexus birth injury, or BPBI, follows a highly variable course. We aren't looking at a monolithic condition. On one end of the spectrum, you have infants who experience mild, transient impairment, cases that might resolve relatively quickly. But on the other end, we see patients facing significant lifelong disability. That variability is exactly why the paper stresses that these infants require careful, regular monitoring.
Right, and as neurosurgeons, that careful monitoring is the bedrock of our decision-making. We can't just look at an infant once and decide on a surgical plan. The clinical picture evolves. The paper notes that this monitoring is what guides the timing and nature of our interventions. Let's talk about the initial approach. Before we even consider the operating room, what does the conservative management look like?
The authors highlight that a variety of techniques may be implemented in conservative management. The primary goals here are twofold: ensuring a full range of motion and preventing muscle imbalances. It's a proactive approach to ensure that if and when nerve recovery occurs, the musculoskeletal framework is actually ready to receive those signals.
Exactly. If we lose the range of motion due to contractures or imbalances, even a perfect nerve repair won't restore full function. Now, let's dive into the surgical side, which is where our audience of residents and fellows will be most focused. When conservative measures aren't enough, what are we looking at?
The surgical management varies, but according to the article, it predominantly involves microscopic nerve grafting and nerve transfers. The choice between grafting and transfers is, of course, a major point of discussion in the field. But the intervention doesn't necessarily stop with the neurosurgical component. The paper mentions that these primary nerve surgeries may be followed later by further orthopedic procedures, depending on the specific needs of the patient as they grow.
That's a crucial point for the residents. We often think of the nerve repair as the fix, but for BPBI, it's often a multi-stage, multidisciplinary journey. Now, one thing that stood out to me in the text is the mention of broad variations. Despite how long we've been documenting this condition in medical literature, there isn't one gold standard pathway that everyone follows.
That's very true. The study points out that there continue to be broad variations between the management pathways favored by different treatment centers globally. One center might lean more heavily towards early nerve transfers, while another might prioritize grafting or a longer period of observation.
And that lack of consensus is exactly why the final point of the paper is so important. It mentions that international research groups are now working to establish a minimum standard of patient outcome data.
Exactly. The goal of establishing that minimum standard is to facilitate more effective future research. If every center is measuring success differently, it's nearly impossible to compare these varying management pathways and decide which truly offers the best long-term outcome for the child.
It's a call for standardization in a field that has historically been quite heterogeneous. For the medical students listening, this really highlights how neurosurgery is as much about long-term data and outcomes as it is about the technical skill of microsurgery.
To summarize for our listeners, BPBI is a complex, variable condition. Management starts with careful monitoring and conservative efforts to maintain range of motion. If surgery is required, we look toward microscopic grafting and transfers, potentially followed by orthopedic procedures. And the future of the field relies on these international efforts to standardize how we report our data.
A concise summary of a very important update. Thank you, Dr. Alara, and thank you all for tuning in to the Neurosurgery Hub podcast. We'll see you in the next episode.
Thank you, everyone.